hello there. Thank you for joining me for the latest edition of Telile 24/7. I'm your host, Adam Cook. On this week's show, we have a feature interview with the man who has been put in charge with a very important medical file for the Nova Scotia government. He's Dr. Kevin Orrell, and he is the Deputy Minister and CEO of Nova Scotia's new Healthcare Professionals Recruitment Committee. I'll have a conversation with him a little later on about what he's doing with the help of his provincial colleagues to help bring new doctors to Nova Scotia and to the Strait of Canso in particular. We'll also review some recent files from Richmond Municipal Council, covering everything from an upcoming protest by long-term care workers to a new strategy in terms of getting accurate numbers on housing needs for the county. But first of all, we're laying down the law. Or more specifically, Richmond councillors are trying to get some answers in terms of why policing costs are going up. The Federation of Canadian Municipalities released a statement earlier this month stating that the new bargaining agreement struck between Ottawa and the National Police Federation will see police salaries and costs rising from a projected 2.5% increase to a whopping 23.7% increase that's also retroactive to 2017. So Richmond Municipal Council is one of a number of local municipalities trying to get some answers from the federal government about whether Ottawa can help out in terms of paying for these extra costs. To get more on the discussion, let's go now to recent footage of this week's regular council meeting for Richmond County, as filmed by Telile Community Television on Monday evening in Arichat. We begin with some remarks from Warden Amanda Mumbriket.
So as municipalities look to pass our budgets for next year, the issue of municipal RCMP costs and the increase that we're facing is really has been top of mind, I know, for many. Municipalities were advised to prepare and were given estimates of 2.5% per year increases, which turned out to be far below the final agreement, which was a closer to 23% increase over 6 years, with retroactive pay going back to 2017. Municipalities were not consulted during the bargaining process, despite its outcome having a substantial impact on our finances. So I know certainly the Federation of Canadian Municipalities has been providing supporting information to help us advocate for support. Essentially what they're asking the federal government to do is to absorb all retroactive costs associated with the implementation of the new RCMP collective agreement. And going forward, that municipalities would be properly consulted prior to the implementation of measures that have a direct impact on our operations. This is a significant mandatory cost that we pay each year in contracted services. So a message sent to us by email also, I'm not sure if councillors would have noticed that one come through. It was through NSFM, but it was from Municipal Affairs Minister John Lohr, who indicated that with this agreement, the RCMP total compensation, including pensions and benefits, is now competitive with other police services and considered to be fair and reasonable for Canadian taxpayers, which is absolutely where we want to be. But again, it does represent a significant cost for municipalities. And so I know that the province is working closely with the National Contract Management Committee to address those impacts. And there has, of course, been some delay due to the federal election and the newly formed cabinet. So at the end of the day, they're still waiting for answers to calculate the exact financial impact to municipal budgets, and I know that they'll share that information when it's available. The bottom line is, though, that the Federation of Canadian Municipalities has suggested that municipalities adopt a resolution that would essentially send a message to the federal government to let them know that we are seeking support to help cover some of those costs that we're going to be incurring. And I know we'll all remember from budget time, it's a significant chunk of our budget, and it is mandatory for us to pay. And although, as much as we absolutely would want that remuneration to be competitive and with other Canadian locations, we still have to be able to deal with that increase, and it's a steep one.
I mean, it's true what they say. I mean, the federal government negotiated this, but municipalities are left holding the bag in this case, and especially the retroactive part. I mean, where we had no say in this, it's not really fair to the residents of Richmond County to have to go back when we weren't involved in the negotiations at all. I have no problem making a motion to support this resolution.
Our numbers have fallen over the last several years, I'm sure, in our residents. The area that covers the same, but the amount of residents in the county of Richmond has fallen. So I guess, to me, two questions we may want to check is, one, do we really need, I guess, the 9.5 police officers that are allocated to our area, would be question number one. And number two is, if we need the 9.5, do we got to go up to the 10 or 10.5 to eliminate the overtime that is being covered? Because the overtime, looking at the paper, the overtime almost was the cost of one extra police officer. Sorry.
The thing is, I don't think that would really matter, because that overtime is a calculation based on like a general average, right? It's not, I don't think that had anything to do with overtime charged here. That was just how they average it out, the cost per officer, basically. So even if you added officers, you'd add the same overtime number in there again, as far as I understood, anyway.
Yeah.
That's what I understood from the presentation
Yeah.
as well, that when the RCMP did the presentation for us, that it wasn't actual overtime in Richmond County, it was overtime over the whole
It would-
process, and then we had our portion of it.
Yeah, it's basically averaged out, so everybody's paying their chunk of it, kind of thing. So if you were to add an officer, you'd still be paying that same fee one more time, basically.
So I guess then we go back to the discussion, do we need the 9.5 officers to cover?
Yeah, and I
You
think
know.
maybe that's probably a conversation for the police advisory committee, where we could kind of maybe do a more in-depth review of that.
And I
That
mean,
makes
maybe we
sense.
can have, the sergeant come in and give us the
Yeah.
breakdown of exactly, I don't need the
How it's
schedule
working
nor
here.
the, but yeah, just,
Yeah. How it's working, yeah. No, that's a great idea, Councillor Digdon, would be to refer that sort of review to Police Advisory Committee, for sure. Would you be opposed to or in supportive of maybe passing this resolution this evening, though, the draft?
I have no problem seconding the motion.
Okay.
For me, looking at numbers of 2.5 and then 23.7, percent, so that's without any consultation or discussion with the municipality. That's,
That's a
to
big
me, is
jump.
alarming for all of us and all the taxpayers of Richmond County. So I would support this motion for sure. Yeah.
So whereas the recent collective agreement between the RCMP and National Police Federation includes significant retroactive pay going back to 2017, as well as pay increases going forward, and whereas our municipality and others that depend on RCMP contract policing are facing significant unbudgeted costs that may force us to make a very difficult choice at a time when our primary focus needs to be on economic recovery from the COVID-19 pandemic. And whereas municipalities were not consulted at any stage of the negotiations process, despite the outcome of these negotiations having a direct and significant impact on municipal operations. And whereas RCMP cost increases will disproportionately impact rural communities. And whereas municipalities are eager to work more closely with other orders of government and the RCMP on contract policing issues to ensure the financial sustainability of contract policing and to maintain the service levels necessary for community safety. Therefore, be it resolved that the municipality of the County of Richmond joins the Federation of Canadian Municipalities in calling on the federal government to absorb all retroactive costs associated with the implementation of the new RCMP labor relations regime, and be it further resolved that the federal government should commit to ensuring municipalities are properly consulted prior to implementation of measures that impact local fiscal sustainability and ability to maintain effective levels of policing services in communities. So could I have a motion? Sorry. Oh,
We had a motion, Brett made the motion.
oh, did you make the motion, Brett?
Yeah.
Oh, I'm sorry.
No,
Okay.
that's fine.
I missed that.
Actually, he said that he
I
would
was-
make a motion to
I
support
thought he said he
it.
would make a
Right,
motion,
yeah.
but I didn't think it was
Yeah.
the motion, so apologies.
If I can make it now,
Yeah.
anyway, I'll make a
Okay,
motion
well,
to
let's firm it
accept
up.
that resolution.
Thank you,
Yeah,
Councillor Brett
I'll
Sanson.
second that motion too.
Thank you, Deputy Warden. All right, so any further discussion?
Question?
All those in favor, please say aye.
Aye.
Aye. Those opposed? Okay, that motion is carried.
Now, even as Richmond Council is looking at how they can pay for rising costs for the RCMP, they're also wondering if they can slow down drivers that are exceeding the speed limits in several communities across the county. So they're wondering about the possibility of rental or purchase of radar speed signs. You've seen them in different communities around our area, most recently in St. Peter's, where the Village Commission has been testing them out. At this week's regular council meeting, Richmond councillors started to wonder if it was possible to rent radar speed signs from the Village Commission or from Nova Scotia's Department of Public Works to be able to slow down speeders who have caused concern in such communities as Arishat and Lewisdale. You're going to hear from the respective councillors from those communities in just a moment, and we'll begin with District 1 councillor Sean Sampson, who told Monday's council session that some people in his Isle Madame district had been raising concerns about speeders over there.
We've all seen them in our travels, and I think we can all agree that they do work. When you see that flashing red speed limit sign going off when you're approaching it, everybody slows down. It gains everybody's attention, right? So during our recent police RCMP committee meeting, there was some residents that brought this up to my attention to see what the chances are of getting some of these radar screens placed in Almadam somewheres. So just wondering if we could add that to a committee of the whole discussion and see what the cost would be, how we go about getting these signs and deciding where to put these signs. Sergeant Ed Nugent had mentioned that the best place is to put them on a straightaway, where you don't want to be coming around a turn and there it is, right? You really want to gain.
Yeah, no, that's right.
You want to gain the speed of the vehicle coming towards it, right? So, I'd like to have an open discussion on the possibility of having those put in Richmond County.
Okay. Deputy Warden, do you have a comment?
So earlier in the year, like through the winter, there were concerns about speed in areas in my district. So I actually had chatted with the Director of Public Works, with Chris, a little bit about it, just to see if he knew anything about those signs. So I can provide you maybe with a little bit of information, and again, I'm sure he can elaborate. But basically, the Department of Public Works is sort of the holder of those speed radar signs. Like
The Nova Scotia Department. of Public
That's right.
Works.
Yeah, sorry, not our
Yes,
Department of Public
yeah.
Works. Yes, now that Nova Scotia is called
Right.
Department of Public. I was trying so hard not to call it TIR that I forgot the Nova Scotia part. So I guess there are portable units, and those are kept in Fall River, and that I'm just looking up the email. Generally used on main roads, again, which is sort of what we're talking about here, but they're rentable, right? So there's a cost associated with that, several $1,000s, I guess, to rent them. Because I know when we had asked, I was like, oh gosh, because it was around budget time, and I was going to present it as something, but then it just seemed to be a bit absorbent for pricing. Yeah, so that was sort of the quick. I almost fell off my chair when I heard it was a few $1,000s, and then I think he had also mentioned at that time, and I just can't find it right here in my email. He had mentioned, I think, that the Village of St. Peter's actually purchased the ones that they had, but they were quite expensive as well. And again, maybe you have more information as it's your district. I'm not
No,
sure.
We got that information back already.
Yeah,
from
yeah.
some-
You did, okay, yeah.
So Yvonne reached out to Megan at the
Okay.
village, the St. Peter Village, and they are expensive
There,
for sure. Yeah.
So I
So
mean, it's
that's-
probably something that we need to maybe consider at budget time,
Right.
because I think that it's something, unless we had a spot in our budget. So
Yeah.
I'm absolutely open to that conversation,
Yeah.
again, because I know I've had similar issues in my own district, so I think we probably all have what we'll call problem areas in all of our districts, but I think it's gonna be a pricey event, so it's something we need to
So-
specifically
Yeah, they were
budget
over,
for.
they were over $3,000 a piece, I think, according to that email, maybe 35.
34 and change, yeah, plus tax.
3,600, yeah, I have it actually
Yeah,
right
okay.
here.
So-
yeah.
So my understanding from having kind of discussed them, the use of them in community projects in the past, was that they're really, really effective at the beginning, but then as time goes on, their effectiveness tends to to wane a little bit. I'm wondering if, since there's an organization that has purchased some in our region, could we potentially rent from them and have them moved around for less funds? Maybe that's something we could explore with the village.
Yeah.
Because, they've been up in St. Peter's for a while
Yeah.
now.
Yeah.
And maybe,
Yeah.
if they were repositioned
Yeah.
and then brought back, what I mean? Like they're,
Yeah, that's,
And-
Or even if we
Yeah.
budgeted to buy a set of them for the county
And then did that.
And moved them around,
rotated
yeah.
them through.
Yeah.
Exactly.
Depending, like the area for me, it's a real problem during school time.
Right.
Yeah.
Right, so like when it would be the summer, it wouldn't be necessary there, but that might be just the time that it's super busy on the stretch here in front of the municipal office or
Right.
something,
That's
right?
right.
So,
Yeah, so I'm thinking a couple things then. We
Mhm.
could inquire with the village to see if they'd be interested in renting them out for different locations and what that cost might be. And then second would be to refer to budget time
Yeah.
to potentially look at purchasing some for the region, for the county. Would that make sense?
mhm.
Okay.
Yep.
All right. So could maybe we'll start with a motion to ask staff to contact the village or to see if they would be interested in renting and what that price would be for the radar signs. Could I have a motion to that effect?
I'd so move.
Thank you, Deputy Warden. Could I have a seconder,
I'll
please?
second that motion.
Thank you, Councillor Digdon. All those in favor?
Aye.
Aye.
Aye. Those opposed? Okay, that motion is carried.
And now it's time for our Telile 24/7 feature interview. This week we're sitting down with Dr. Kevin Orrell. He's been active for many decades in the healthcare system in Cape Breton, particularly in the Sydney area. Now, from his office in Halifax, he's overseeing a brand new government committee that was set up specifically to try to bring more medical professionals to Nova Scotia. It's the Healthcare Professionals Recruitment Committee. Dr. Orrell is the Deputy Minister and CEO for this committee, which works under the auspices of Nova Scotia's Department of Health and Wellness. So we're going to spend some time with him to hear his strategies and his committee's strategies for bringing more doctors, nurses, and paramedics to Nova Scotia, but also what he feels hasn't worked in the years leading up to the striking of this committee by the Tim Houston government once it took office this past summer. Here's our chat with Dr. Kevin Orrell right now. And we're pleased to welcome to Telile 24/7, taking some time from another busy day at his office in Halifax, the CEO of the Healthcare Professionals Recruitment Office and the Deputy Minister in charge of that office. He is Dr. Kevin Orrell, and we thank you very much, sir, for giving us some time on Telile 24/7 today. Welcome to the program.
Thank you. My pleasure.
Good to have you here, and obviously let's hit the ground running. You have been a deputy minister at the Department of Health and Wellness for a while now, and obviously physician recruitment and healthcare professional recruitment is not a new issue, but can you give me a sense of whether becoming the CEO of this new office set up by the new provincial government of Tim Houston has opened your eyes a little more to what's happening both on the provincial and the local level? Is it better, worse, or about what you expected?
For 32 years, I worked as an orthopedic surgeon in the healthcare system, and I went originally with one other orthopedic surgeon. So for 10 years, I worked every other night as an orthopod, and that was very, very those were difficult years. I was involved in trying to find manpower to come and to work as orthopedic surgeon in Cape Breton to help us out. And so my interest in recruitment and retention, for that matter, went way back to my early practice years when we were trying to fill our complement of orthopedic surgeons to serve the island and Eastern Nova Scotia. The fact of the matter is that we did a good job with that. And then recruitment became an issue for the health authority. And I also had some interest in helping out with that. I could identify students who were studying in medical school. I had names and contacts of people who were residents across the country. And I would often introduce those people to the recruiters. Sometimes they would follow up on it, sometimes they wouldn't. It was very inconsistent as to whether or not the information was well received. And of course, at that point, I didn't have an official position as a recruiter. When I came to the Department of Health and Wellness as the Deputy Minister in April of 2020, I landed right at the start of the first wave of COVID.
Yes.
So there, as you know, there were many distractions at that time. And the issue of recruitment came up more or less as an urgent or emergent thing when people were leaving practices and there was no one to replace them. As COVID settled a bit, recruitment was one of the issues, but of course, it was one of many, many issues that the department was dealing with at that time. So the current Conservative government ran on a platform of healthcare reform. And I think by forming this office of healthcare professionals recruitment, they have identified their priority and put significant focus on it by creating an office that can do it exclusively. So I'm very pleased to be involved. As I said, I did it for years, more or less as a volunteer within the system. And now I have some sort of official position to exercise many of the things that I've observed over the years and try to apply those to filling positions in the province.
I am curious, Dr. Orrell, as to whether you feel anything specific has happened during the time that you mentioned and the time you spent in physician recruitment that's made it more difficult for Nova Scotia in particular, but also for areas like the Strait, like industrial Cape Breton, to be able to bring healthcare professionals in. Did any one or two factors come into play over the last, let's say, 10, 15 years that has made the job of people like yourself harder and still makes it hard today?
Well, there's a couple of things on that front. There are the changing patterns of practice that exist. So, for example, the way doctors who graduated, at my time or before me worked is very much different than our current graduates work. They still work full time, but outside of Central Zone, they enjoy a variety of ways in which to practice, in which to work. So family doctors are not in their office every day. They do things that the community needs, such as emergency coverage, urgent clinic coverage, hospitalist work. They work in palliative care, addictions, and other types of specialized clinic like Well Women's Clinic and things like that. So the family doctors are not in their office as much. So if you take an older physician who retires with 4,000 patients on their panel, it would take 3 current graduates to cover that volume of people in a practice setting. So that's one thing. And I think there is, I've seen it now more than ever, there is certainly more interest in families, young families, current graduates, to be in more urban centers, to be closer to facilities, to be closer to airports and things like that. And so I think there has been some dissolve, if you will, of the interest of doctors to go to rural environments. I think largely because perhaps they don't understand what it's like to live in a rural environment. I often maintain that I don't think we're as rural as people imagine. For example, in rural medicine in Australia or South Africa, where they have to pay back after medical school. I mean, they have to fly these people in on float planes or helicopters to get them to the site where they're going to work. In our communities, no one is that far away from a larger center, from a shopping mall, from a hockey rink. So it's not quite the same, but we do have an impression that rural medicine in Nova Scotia is far away. And I don't believe that's the case.
Well, I really want to jump in on rural medicine because obviously we're coming to you from the Strait of Canso. You're familiar with some of the struggles this area has had over the years. And we have seen over the past 2 years the establishment of a committee, the Cape Breton South Recruiting for Health Committee, that has put extra focus on bringing new physicians, new medical professions here. Are you aware specifically of efforts like this, and do you have a sense on what's been happening in the Strait in terms of doctor recruitment, and also what you can do to join forces with the local efforts to be able to bring physicians and other medical professionals here?
Well, I have been, and the Strait has been an active area for many years, and I reference again those years when I was working clinically. But there has been, with the clinic there and the support the community has given to doctors, they've done well for many years. On the issue of community engagement, I think the important thing is to recognize that the communities do play a significant role. So our office, for example, can recruit or entertain a doctor and try to convince them that, you know, Nova Scotia is the place to come. I think the communities have to do that work with their families to you know, express their interest in having them come to live in their community, and to demonstrate and to show them what it would be like to live in a smaller community or a rural community. That's an important aspect of the whole recruitment process. There are recruitment teams in each zone of the province, and they work collaboratively with the health authority. And there's different communities that have connections to that recruitment team. So some are very, very strong: Pictou County, Yarmouth, Lunenburg, and the Strait, I'd say, is really ramping up for sure. On the weekend, I did receive an email about meeting with the group from the Strait, and I have every intention to do that. Committed over the next couple of weeks, but I think in early December I'll be able to meet with them, and then they can join forces with the resources we have here in the office, and we'll work together for sure to improve the situation in the Strait area.
You mentioned meeting with people from the Strait, and I know that part of what your office is doing right now is getting out and speaking to family physicians in different parts of the province. It looks like Cape Breton is going to be among the first communities that's being taken care of, both the urban areas and, as you mentioned, the Strait. What can you tell me about the importance of these specific meetings, these one-on-ones with family physicians and others around the province?
Well, the unique or the one-on-one experiences we've had, the sadness of it is quite often the people identified have expressed interest in coming to Nova Scotia before, but for whatever reason, the system fell flat and it didn't really engage them. So some of them have lost interest, but are reigniting their interest because, well, for many reasons. One, I think, has to do with the Nova Scotia response to COVID. I think it's been a very exemplary province to observe, and people seem to have a level of comfort with coming and entertaining the thought of working and living here. The doctors themselves can be engaged on a one-on-one basis. On a larger scale, we are trying to look at groups of individuals who might be interested. For example, Nova Scotia educates a large number of family medicine residents, and in Halifax, residents of other specialties. And we're going to reach out to the residents to see if after their years of training that they would find Nova Scotia an attractive place to work. And we would support them working and joining a practice, or perhaps even coming together as a group and forming a new practice. So this is one of the reach outs to try to gather many people. We do have recruiters with the health authority team I mentioned who reach out to all DAL medical students. I would point out that the office is recruiting healthcare professionals of all sectors. So as you know, the Premier has reached out to nursing students, for example, and he has offered jobs. And we will be reaching out on an ongoing basis to the students who are in nursing school, to the LPNs who are training, and to our CCAs. So we're very interested in all the sectors as well. Paramedics, another big group, pharmacists. So the door is wide open.
Dr. Orrell, you've cited a couple of examples, and the nursing example in particular, where we were hearing students that had graduated from nursing programs in Nova Scotia earlier this fall saying that they weren't welcome or didn't feel they were welcome to apply for positions in their own province. So your office and the provincial government in general have addressed this. Can you give our viewers one or two other examples of practices that would have been in place in the past that may not have worked so well, that have seen a significant change in terms of reaching out and not only bringing people here, but also retention of medical professionals here? Are there one or two changes in the program that you can tell us about?
Well, Nova Scotia had some kind of a workforce resource plan. It's very old, and it indicated how many family doctors should be in a community, how many specialists should be in a community. And that was a very limiting aspect of recruitment. So if, for example, we needed a general surgeon to come to a community and he was married to a family doctor, and that community had their quota on that old workforce plan, they would refuse the guy because they couldn't offer a job to his spouse. This is old thinking, and it isn't critical thinking. If a general surgeon wants to come, then given the amount of people looking for family doctors, we'd be crazy not to, offer a job despite what might have been considered a quota number. So we've taken that all apart. We're currently going to get a more up-to-date workforce resource plan. But in the meantime, we're not going to discourage anybody who wants to come as a couple, as two doctors in a family, and disqualify one from working simply because of numbers. So that's one way we've done it. We're looking at, I think it's critical thinking that if we need a pediatrician in a zone, and that person is married to someone of another subspecialty, then we're going to employ both those doctors. We're not going to turn anyone away.
Mm-hmm. Last question to you, Dr. Orrell. Where do we go from here? I mean, your office is just a few months old, and this is a problem that's been decades old. It won't be solved in 5 minutes by any stretch. But what do you see for 2022 in terms of the new priorities for you, your office, and recruiters in the provincial level as we go forward into the new year?
Well, I think the best way to put it is that we are going to try to do things differently than has been tried before. And by that, I'm referring to the fact that every political party has formed government, and every political party has made an attempt at improving the healthcare system. Yes. And it doesn't seem to be a permanent improvement. So we have to change policy. We have to change the way we do things and what we are asking our doctors, our healthcare professionals to do, so that the change can extend into the future and be more permanent, so that we're not every 4 or every 6 years in the same kind of urgent situation that we're in at this point in time, trying to find nurses to fill all the needs of the hospital and the long-term care and continuing care sector. And we're not looking for doctors all the time on an urgent basis. So the plan would be that we make arrangements to address shortages, to address people who are aging and going to retire at a much earlier time. If we have to overlap and bring people in, as I said, over and above their whatever their allotment is, then I think we should do that. I think we should have people in place so that when someone finishes practice or leaves for another reason, then we're not always struggling to find a replacement. We've got people that are already in that community and that are working, so we don't have to hustle and have this gap of service for a period of time while we find someone.
All right, we've covered a lot of ground in a short time, Dr. Orrell, and I thought that would be the case. I appreciate you giving us some time. Did you want to add anything else about all of this just before we wrap up here?
Just to say that the office is newly formed, and we have most certainly hired and are bringing people to the province, again, in all of the different healthcare sectors. Some people say, well, when do I see the results of that? Well, some of the results will take time to realize, because some of the people that we've recruited are finishing training. They'll be done when they do their exams in the spring, and then they'd be ready to come to the province or set up a practice sometime through the summer months when they're finished their residencies at the end of June. Some doctors from overseas, from the UK or from other countries, they will be coming to Canada, and they will have to go through the immigration process. And so that takes time. So we've made some very significant efforts to find people. They seem to be willing to come, and I think we'll ultimately do that. It just takes time to realize the impact of those people. As I said, we're very concerned about the other healthcare professions. It tends to get focused a bit on doctors, but we are certainly interested in nurses and LPNs and continuing care assistants to support the whole system, because we know if one part of the system fails, the whole system does.
Very much so. Yours is a difficult and sometimes thankless task, Dr. Orrell, and we appreciate you taking a few minutes away from it to speak to us and tell us about all of this today. Thank you so much for joining me on Telile 24/7.
My pleasure. Thank you.
Thank you. Dr. Kevin Orrell is the Deputy Minister and CEO in charge of the Healthcare Professionals Recruitment Office for Nova Scotia. We've been speaking to him from his office in Halifax. Stay tuned for more of Telile 24/7 in just a moment. A key part of Nova Scotia's healthcare strategy is, of course, long-term care. And several long-term care employees under the Canadian Union of Public Employees aren't happy with the way that the system is going at the current time. So, CUPE employees across Nova Scotia are holding a day of awareness concerning long-term care this coming Tuesday. It's going to be taking place locally in St. Peter's and in Arishat, where several members in these communities are working at the Richmond Villa and St. Anne's Community and Nursing Care Centre, respectively. So here's a look at how Richmond Municipal Council feels about these particular information pickets, beginning with Warden Amanda Mumberket speaking at the regular council meeting that took place in Arishat this past Monday.
On November 30th from 11 a.m. to 1 p.m. at the empty parking lot across from Louis Cozy Corner, the old Irving garage where it was there. CUPE, which is representing long-term care workers, will have an information public awareness picket happening across the province on that day, and specifically in that location. The day is really to raise awareness of staff shortages, to increase staff ratio levels, to ensure adequate care is available to meet the needs of all residents. And it's also to ensure that staff are paid fairly and competitively, and vacation and time off are granted to avoid staff burnout. It's obviously our long-term care facilities have been under a great deal of strain, especially since the pandemic began. And I know that a lot of times there's not enough people to handle the workload, and it's been a really stressful time. So I just wanted to take this time, or this moment, to express Council's appreciation for the work of our long-term care professionals in our communities. I look forward to supporting them on November 30th and in the days ahead, but just wanted to kind of let Council and public know that action was going to be happening as well, and encourage you to reach out to some, long-term care workers in your community to express your support and appreciation of them, for sure. It's really kind of in line with the work that we've been doing anyways with Cape Breton South Recruiting for Health as well.
There's going to be some people as well at the St. Anne Centre on November 30th. Yeah, so I will be showing my support as well, yes.
Some of our Telile viewers might remember that at November's Committee of the Whole meeting for Richmond Municipal Council, there was a wide-ranging presentation by the Cape Breton Partnership. Well, it turns out that the partnership now wants to offer Richmond County the opportunity to get some data together on a big issue for the county over the past couple of years: affordable housing and housing needs in the county overall. So it looks like the Cape Breton Partnership and the municipality are going to partner on a new housing survey, similar to the ones that the partnership carried out earlier this year in Port Hawkesbury and also in Inverness County and the Cape Breton Regional Municipality. How is it all going to work? Well, here's Richmond Warden Amanda Mumberket explaining how it'll all shake out and getting some feedback from municipal councillors at the recent Municipal Council regular meeting in Arichat this past Monday.
So I just wanted to kind of get a sense from councillors if there might be an interest in asking them to do such a piece of work for us as a county. I mean, I know that I've reported back to you on the work of the Straight Richmond Housing Matters Coalition and the work that that group does, but this would specifically be something for the county, whereas that's a more regional group. And I do know that you know, given with the new provincial government in place, there is going to be some, I think, additional work done on housing and some research being conducted on housing across the province.
Would there likely be a cost incurred to the county on that, or what would?
To my knowledge, there hasn't been in other places. I mean, we do invest in the partnership, so my understanding is that it would be just specifically a use of staff time.
Yeah, and I believe Carla said that when she was here, like that it was something they would be able to do.
Okay.
Pro bono. Yeah.
So if folks are in agreement, could I have a motion to ask the partnership to support that work?
I'll make that motion, Madam Warden.
Okay. Thank you, Councillor Sean Sampson. So could I have a seconder, please?
I'll second that motion.
Thanks, Councillor Digdon. Any further discussion?
Question?
All those in favor, please say aye.
Aye.
Aye. Those opposed? Okay, that motion is carried.
And that wraps up this week's edition of Telile 24/7. Thank you for tuning in, and a big thank you to my interview guest this week, Dr. Kevin Orrell, the Deputy Minister and CEO of Nova Scotia's new Healthcare Professionals Recruitment Committee. And a special thanks to my Telile colleagues, Becky Bourinot and Nick Boudreau, for filming and formatting the footage from this past Monday's Richmond Municipal Council regular meeting. If you have any thoughts or comments about what you've seen over the past 45 minutes, or if you'd just like to make suggestions for future editions of Telile 24/7, I'd love to hear them. You can contact me directly. My phone number is 902-625-8863, and you can reach me by email using the address adamjrcook, cook with an E, @gmail.com. Also, you can contact Telile Community Television directly. The station phone number in Arichat is 902-226-1928, and you can reach them by email using the address info@telile.tv. Don't forget to follow Telile Community Television on social media. We're on Facebook, Twitter, Instagram, and YouTube, and our YouTube channel features every single edition of Telile 24/7, including this one, as well as the episodes of our sister shows Roundtable and Notre Côté. I'm Adam Cook. Thank you so much for tuning in once again to Telile 24/7. I look forward to seeing you again next week with a brand new show. Bye for now.